Patellar tendonitis. Nathan Williams, Darian Foreman. The injury. Max, a junior in college, is preparing for his senior basketball season. He has been training for weeks, pushing his body to the limit almost every day. Squats, extra sprints, rebounding, medicine balls, all kinds of stuff. With all the extra time Max has been putting in to improve his performance, he has noticed a burning sensation getting worse in his right knee. On the last day of spring training, halfway through practice, Max approaches his athletic trainer. He explains to him that he has been experiencing this pain, but it has now worsened to a point of being unbearable. Patellar tendonitis. Patellar tendonitis, or jumper's knee, is an injury that affects the tendon connecting your kneecap to your shin bone. The patellar tendon plays a pivotal role in the way you use your leg muscles. It helps your muscles extend to your knee so that you can kick a ball, run uphill, and jump in the air. Immediate care. When Max comes off the court, as trainers, we will wrap an ice bag around it to reduce the swelling. We may also recommend that he take an anti-inflammatory pain reliever should it bother him. Once the certified athletic trainer has made his or her diagnosis of patellar tendonitis, they also tell Max that he should see the team doctor to get a definite answer and idea about what sort of treatment he should do. The doctor does diagnose Max with a patellar injury from overuse and relays back to the certified athletic trainer the course of action for Max and his injury. Plan of care. Throughout Max's treatment, the physician, trainer, and athlete need to communicate with one another. Proper communication can result in a safe and quick return. Treatment. Leading up to the first game, Max should continue to rest his knee, icing it, and then consult his trainer to see what other rehab and exercises he should be doing. When Max comes into the training room, the trainer wants to get an idea of what to do. He asks Max if he has ever hurt his knee before, watches him walk, and feels the different parts of his leg to see where it hurts Max. Max is provided with a knee brace that pushes on his patella to reduce stress and provide extra support. Once the trainer gets a good idea of what Max is comfortable with and capable of, he gives him an exercise card. The card has some exercises and stretches on it that should help strengthen and reacquaint Max's knee to his normal routine. The trainer demonstrates some of the exercises to Max and shows him how to properly complete his sets. Once he finishes all exercises, we perform some muscle stimulation on his quadricep, ultrasound his kneecap, and compress, ice, and elevate his knee. Rehabilitation. Throughout Max's treatment, we will be following the 5 stages of rehab: immobilization or rest, restoring range of motion, general strengthening, functional strengthening, return to play. Immobilization, rest. During the stage, we'll be sure that Max's knee gets the proper rest. We will go through the rest, ice, compression, elevation, or RICE protocol, and most likely provide him with a brace to alleviate stress on the patellar tendon. Range of motion. Restoring joint motion and making sure Max's normal motions in flexion, extension, and jumping do not cause discomfort in his knee. General strengthening. Restoring proper strength to the quadricep and reacclimating the stress the quad puts on the patellar tendon. Accomplish this through one-legged squats, lunges, high jumps, and jump ropes. Functional strengthening. Once the quad has been strengthened and Max feels no pain when exercising, we move to more basketball-oriented drills: rebounding, sprinting, lateral movement, etc. Return to play. As we work with Max and he makes improvements, we will update the team attending physician. Once we have seen that he completes normal, full range of motion exercises and drills with no discomfort, then we will maintain stretching and strengthening the surrounding muscles to keep Max on the court for the season.